Welcome to 4,500 Births Later. We're Sarah and Catherine, two Canadian labor and delivery nurses. We give you honest guidance from the people who do this work every single day, so you can walk into birth feeling calm, confident, and supported. Hi there.
Hello.
Today we have a very special guest with us. A very, very special guest.
Oh,
wow. Dr. Charlene Kennedy, welcome to the show.
Well, thank you for having me.
Thanks for being here.
I'm excited.
So if you can tell us a little bit about yourself.
Okay. So I have been a family physician for 24 years. And since I started, I've been doing obstetrics, so low risk obstetrics with a prenatal group at the Rocky View. And then I also have a family practice and I do aesthetic medicine on the side.
Busy lady.
Busy.
Very good.
We had picked a topic about birth plans.
Yeah, sounds good.
What are they? What do you think of them? Who's using them? Where are they getting information from? What makes a good one? Are they necessary?
Okay.
Anything.
So lots of questions there. Hopefully I'll remember all of the ones you asked. So a birth plan from my perspective is just patients kind of writing down before they go into labor what would be their ideal scenario. So we have on our website, we have a very basic birth plan that they can print off. And then we like to start talking to them at about 30, 32 weeks. So we ask them to write it down, they bring it in, and then we go through it together. So some people have very detailed birth plans and some people it's very generic, kind of what we would normally do. I always encourage them by saying the goal is to have a healthy mom and baby at the end of the day. So whatever it takes to get there, that's what we both want. The other thing is safety is always first. So sometimes you do get some wishes that are not doable. So it's always better to discuss it with the patient before they actually turn up in labor. I would say maybe a quarter of people come in with a birth plan. It's not necessary. It kind of depends on the patient. But I would say the majority of patients don't do a birth plan. We, as a family provider, I think we typically talk to them about a lot of different scenarios at different parts in their pregnancy. So we're talking about pain control. We're talking about what does labor look like? We talk about kind of the general process. What would be reasons that they might need an induction? What would be reasons they might need a C-section? So I think we kind of, touch on a lot of those topics already. Yeah, some people come in with 10-page birth plans and I think it's really important, especially patients that are maybe a little bit more anxious, to sometimes you have to deal with the anxiety because it's really more about their anxiety than about actually having a baby and some people are adverse to hospitals. So you also want to explore, did something happen to them previously in a hospital? Is there some trauma there? So there's a whole bunch of different reasons why people put different things on a birth plan. And sometimes you just say, yeah, that's not happening in the hospital. Sorry.
Right.
It's not going to go that way. And I think for some people, especially if they've never had a baby before, they just don't know what to expect. And then they're watching YouTube, TikTok, hearing all these things from their friends. And a lot of it is misinformation.
Yeah. Worst case scenarios. Yeah.
Which just feeds into the anxiety, it doesn't calm them. So
right.
I've had to tell people, I've actually had people, sign something saying that they will not go on TikTok or Google things.
Oh my gosh.
This is brilliant.
Yes, because
Absolutely
honestly,
brilliant. I love it.
For some people, it causes so much anxiety that they can't even enjoy the pregnancy. They're having a totally healthy pregnancy. Everything's going well, but they're so consumed with the what ifs, what they've heard, what they've seen, that I will actually say, okay, you are not allowed to go and Google, TikTok, YouTube. If your friends talk to you about the pregnancy, you just say, my doctor says I'm not allowed.
But you could recommend 4,500 Births Later to them.
You can still listen
The
to
name of our podcast.
Absolutely, I could, because the information is valid.
Yes. Coming from the people who see it, who do the job, who deal with the misinformation daily. So, we're so happy to have you here today to clear some things up, some hot topics that are definitely flying around that we would love for you to put to bed here.
Yeah, there's a lot of stuff out there, crazy stuff.
What's the craziest thing you've heard?
Oh, you're gonna put me on the spot. I don't even honestly, I don't know. There's just so much stuff. I can't think of one.
If it comes to mind
Yeah,
throughout our
if I
conversation,
can remember, I will
just
tell you.
jump in.
You know, like
Yeah.
people go, "Oh, I'm gonna eat 5,000 dates a day." I don't think that's a good idea. It's not gonna put you into labor, but it's gonna give you a ton of sugar and you'll probably have diarrhea. Just
Yeah,
saying. Do you
not
want
a good idea.
and I'll say, "Do you wanna have diarrhea while you're in labor?" And they're like, "No." I'm like, "Don't eat those
Was
thousands of
Is
dates."
that for an induction, like
No,
naturally
they just
inducing, or
have
what was
heard
the
that eating
rationale?
dates can bring on labor.
Oh,
I'm
okay.
like,
Yeah, yeah. Oh,
"No, I don't think it does." Yeah.
Not a good idea.
Yeah, if you wanna have a few dates, that's okay, but, yeah. Anyway.
One of birth plans I had recently in the room, a patient had birth trauma, which I take very seriously.
Mhm.
And so it was actually quite interesting to read. She had a diagnosed fear of
Mhm.
surgery. And of course, as we all know, that's an option. We spent basically the entire labor process just talking about, if it comes to this, how is this looking different than last time? And for her, she was with a new partner. Her previous partner was abusive,
Mhm.
on and on. So I found that very interesting. And I was actually happy that she had kind of written that out in a paragraph explaining
Mhm.
why she had this fear. And then it was passed shift to shift so that everyone was on the same page with her. Because I think if that's the number one thing going on in your brain, you're not present. You're not in the room enjoying the process. For me, birth traumas are actually a good one to have written out.
Absolutely, and I think, like, as a low-risk provider, I want to know that about my patient before so I can talk to them throughout the pregnancy, and it's, on their chart and everybody's aware. Um, because sometimes, maybe if they get some counseling during the pregnancy, maybe they're not so scared during the process. But I think it's hard sometimes because we can get a little frustrated sometimes if it's a really busy day and you don't have time to take to explore those things. But I think it's always better to have those discussions before it's actually at
Yeah.
the time, right?
Yeah, for sure.
Yeah.
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 And as far as a birth plan, if someone's going to have one from a medical perspective, as a nurse, and I'm sure as a doctor too,
Yeah.
a one pager is a lot easier to read than
Yeah.
something like this, pages and pages. 'Cause
Yeah.
time is
Yes. One pagers are perfect.
Yeah.
Yeah, they're perfect. I think on ours, I can't even remember what it actually looks like on our website, but I think it's very basic.
Yeah.
Like, and it's one page, it's not a long one. It's all the stuff that we would normally talk to them about anyways. But yeah, so it just makes it easy. And most people, I would say for the most part, are receptive when you go through it and you just say, "Sorry, your husband's not going to deliver your baby." Like that's,
Yeah.
I know some providers will let them get their hands in there or whatever, but, if someone has something that's very unusual, most people are receptive to saying, "Sorry, we can't do that. This is why we can't do it." And then you do have some people that are a bit angry, but,
I
"Sorry,
think
we're going to."
that your husband not delivering your baby would be an easy one to explain. If your husband gives you a 4th-degree tear,
Yeah.
would you ever
Are you going to
forgive
be
him? Are
angry
you
at
going to live
him
in
for
the
the
same
rest of
house?
your life? Yeah, that might lead to divorce. Do you want that? Yeah.
Yeah,
No.
that'd be an
So,
easy one.
but it's actually surprising how many women or they ask for that. Can my husband be involved somehow or can they deliver? And
Oh
I'm
my
just like,
gosh.
no.
It's
No.
so wild, eh? And then there's the other extreme where they don't want the husband looking below the belt.
Yes.
They're like, you just have to look at my face or the wall. You can't look down
Yes.
there.
Yeah.
So,
And
two
and
extremes.
not, and again, there's so many cultural differences,
Yeah.
right? So even when people come for their routine prenatal appointment, sometimes they ask their husband to leave just to listen to the baby. Like you're literally just lifting their shirt up.
Oh, wow.
Yeah, or they'll turn around, like the husband will turn around,
Yeah.
or some women actually keep like trying to push the shirt down, and I'm like, I'm sorry, but I gotta pull
Yeah.
it up again,
Mhm.
like, but yeah,
Yeah.
it's interesting. A lot of cultural things that you
Yeah.
have to take into account as well.
Yeah.
Yeah,
And relationship dynamics as well.
absolutely.
we've met a lot of men that are
hmm
queasy as well, that have fainted at the sight of blood.
Well, my husband, when I was pregnant with our first, he said he wasn't even coming in the room.
Hmm.
And I was like, oh, yes, you are. And then I said, he could stay he didn't have to look down there,
Mhm.
everything. And then he was down there like a dirty shirt.
Oh
yeah.
my gosh.
I think it was with MJ Walsh. Like that would have been 25 years ago. And she was saying like, Jay, go sit down over there. It's like, leave her alone.
Yeah.
Get out of the way. Yeah, it was kind of funny. So they can change too.
Yes.
Yeah.
Yes. Okay, let's get to some of the specifics
nitty-gritty?
of
Okay.
birth plans here. Okay, starting at the top. Who should people have in the room with them, and who can they have in the room with them? Some of these birth plans I'm seeing, can my children come in? That's one of the options that are listed here. So who would you recommend as labor support?
Yeah, I mean, usually for labor support, it's the partner, unless the partner doesn't feel comfortable. Some people have doulas who are provided for support only. It's really whoever they feel comfortable around. I would say not more than 2, which I think is hospital policy, and I
Mhm.
agree with that. When there's too many people in the room, everybody's giving their opinion. It's just, it's a bit chaotic.
Right.
With regards to children, that's a tough one. I personally don't think young children should be there. Like that's got to be quite traumatizing seeing, even for husbands, sometimes it's traumatizing seeing their wife in a lot of pain and there's been,
Mhm.
I'm not a big fan of that. Some women want their teenagers there.
Birth control.
Maybe. I don't know. I wouldn't have wanted my teenagers there, but to each their own. So I would say in general, whoever they feel the most comfortable with. And I've had some patients where the mother-in-law is expecting to come. And then when I've talked to them privately, they're like, please don't let my mother-in-law in the room.
Yeah. I've
And then
had
so
that
you
before.
have to kind of I'm like, just blame me. Just say I said no,
Mhm.
like put it on me.
Yeah.
And yeah, so sometimes it can be, again, it's like a cultural thing or a family expectation, but they're not comfortable. So I'm like, just blame me.
Yeah.
Yeah. Or
Yeah.
I will say something if you don't feel comfortable. But again, this is a discussion that I like to have before they get there. Yeah.
If we could just go back for a minute, you had said doulas. What specifically is the role of the doula? Because I think sometimes this can be a little bit confusing
Yes.
and it's important to clarify.
Right. So a doula is there for support only. That's it. No medical advice. Even if they have some training in medicine, they are not providing medical care. So in my opinion, doula should be there for support only.
Okay.
Yeah. And I do talk to my patients. If I know that they're having a doula, I will reiterate that and say, your doula is not there for medical decisions. You shouldn't be looking to your doula to ask them if they're, if let's say we recommend a C-section, you should not be asking your doula, do they think you need a C-section?
Right.
Like
They
are
have
there
no
for
medical
support.
training. They are.
They're there for support only. End of story.
And when you say support, you're talking emotional and physical support.
Physical, rub my back, like whatever, talk to me, get me through this. And they, studies have been shown that they actually do help considerably in that regard with patients in labor. But that's where the line ends, in my opinion.
Yeah.
Yeah.
That's fair. I think we both agree with that. Hey?
Yeah.
Yeah.
Very much. Very much.
And I think sometimes, patients have I would say most of the patients that come to us don't, but occasionally they might have a negative perspective on healthcare providers. So, I always reiterate too that our goal is for them to have a good experience, but at the end of the day, to have a healthy baby and mom. And, like I said to you guys earlier, our mandate is first do no harm, and we take that very seriously. So again, it's often just a conversation. Yeah.
Yeah. It's difficult sometimes if you get put in different boxes, versus them sort of thing.
Yes.
So that's one thing that I like to work in the room is that we're all in this
We're a
together.
team.
And we're actually just listening to what the baby is saying, what the baby's driving the bus, right?
Yeah.
The baby's calling the shots. So we're all just doing the best we can to, support you and in this
Yeah.
labor wherever it may go.
Yep, absolutely.
I think doctors, nurses get a bad rap for they made me do this. They,
Mhm.
forced this down my
Unfortunately.
throat. And
Well, and I think for some people, if their labors don't go exactly how they imagined they would go, they have a hard time accepting that sometimes. So they're looking for someone to blame, right? And so it's usually, sometimes it can be the medical staff. And I think it's just they're just looking for someone else to blame because they don't want to accept how things went,
Mhm.
which, and over time that usually gets better. But like I said, for some people, it's very traumatic.
Yes.
Yeah.
Yeah, and as a healthcare professional, what you think they're taking away versus what they're
Mhm.
taking away is very different because of
Yes.
their understanding of how everything went down. Whereas we see the same thing happen over and over and over again. So
Right.
it's just,
We're a bit desensitized.
Yeah.
Like we don't get as worked up about some things as we've seen it a million times,
Mhm.
right? It's just part of our day.
That's right.
Yeah.
Now let's move on in this birth plan. Okay, let's talk about the environment of the room. So some people are requesting dim lights, aromatherapy, quiet voices. This is a fun one that they get to eat throughout their labor. What are your thoughts on some of those?
I think all of everything but the eating,
Okay.
I'm totally fine with that. I mean,
Okay.
I know the hospital is a scent-free zone.
Mm-hmm.
And lots and lots of people are sensitive to scent. So I get that. If
Mhm.
they say no scents. The eating in labor, again, I usually try and tell patients why we don't want them to eat because labor is very, as we know, extremely unpredictable. You can have something, the fetal heart, that looks absolutely beautiful and it changes drastically in 2 minutes. So I always explain to them, we don't want you to eat in case you need a C-section. We want your stomach to be as empty as possible. That's why we don't want you to eat.
Mm-hmm.
And most people are pretty receptive to that.
Yeah.
Yeah.
At what point do you suggest that? Once they're a patient in the hospital?
Mhm.
Because sometimes people come in early labor and, they're coming and going and
Yeah.
they start starving themselves for a few days.
Yeah, no. So I think once they're admitted in active labor, and if I see someone in early labor, depending how close I think it's going to be till they're going to be readmitted, I might say, you can still eat, but just eat something a bit lighter. Don't go have like a turkey dinner, you know?
If we can just simplify it even further, what would active labor be?
So we now can, I mean, it's changed a lot over the years, right? Compared to when I first started. If you've had more than one baby, we're going with like 4 to 5 centimeters. Same for primes, kind of 3 to 4. But again, sometimes we admit them when they're not truly in active labor, but they just cannot cope. Like you just know there's no way these people are going home.
Mm.
But for the most part, I think that's hard for people because they come in thinking they're 10 centimeters and then you go, oh, you're 1 centimeter. Yeah. And
And
they're
they're
like, what? Yeah. What do you mean? I thought I was going to have my baby in an hour. I'm like,
Mhm.
no. But so, yeah, I mean, it's changed a lot. And I think it's changed a lot because we just don't have the capacity like
Yeah.
we used to.
So you mentioned centimeters,
Mhm.
but people out there, they don't know how dilated they are. So contraction wise, what is that looking like?
Right. So we usually tell our patients that, so for a multip, I'll say once your contractions are about 5 centimeters apart. And if you're sitting there calmly and relaxed, you don't need to come. If you're, and I jokingly say this to the husband, I say, if she looks like you, like she's going to die, it's time to bring her to the hospital. For primates, I usually say, about 3 to 5 minutes apart. And again, depends on how you're coping.
Yeah.
Or if your water breaks, you're coming to the hospital. If you're getting bright red heavy bleeding, you come to the hospital. If you get a tiny bit of like mucusy kind of discharge, I don't get too worked up over that.
Mhm.
But
Mhm.
most people come anyway. Yeah.
Or show us photos.
Yes. Or bring, yes, photos, pads, the whole,
Yes.
yeah.
We've
Yeah.
seen it all.
Which
We've seen
sometimes it can
all.
be helpful.
Oh, it's totally
I
helpful.
get tons of
Yeah.
baby poop diaper photos. Yeah.
Mhm. I think I've taken a few myself.
Yeah.
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 That mucusy poop with
Yeah.
babies.
Mucusy poop.
Yeah.
Exactly.
Okay, so we've kind of talked about the setting of the room. Now we're talking about pain management. What are people are requesting? Standing epidurals, walking epidurals, all of that. So what what are the limitations?
Yeah. So again, we usually have this conversation when they're about 32 weeks. We kind of go over the different pain options. So non-medication pain options, you can go in the shower, you can go on the ball, you can walk around, and then we get into the medication options. So there's the Entonox gas, then fentanyl, morphine, which are narcotic medications, and then the epidural. And I always warn them, although we call it a walking epidural, you are not up walking around. It just means that you might have enough leg function to go to the bathroom.
Mm-hmm.
But it's a little bit of a misnomer.
Yes.
And I think a lot of people think, oh, I'll get the epidural and then I'll walk around and
Mm-hmm.
Go to the
No.
cafeteria.
yeah, go to the cafeteria, whatever. And I'm like, no, that's not what happens.
Mm-hmm.
As far as I kind of tell them, look, this is your party. You get to decide. If you want to go straight for an epidural, go straight for an epidural. If you want to try everything under the sun, go for it.
Mhm.
Unless there's medical conditions such as high blood pressure or certain, situations where then I will actually recommend an epidural. I mean, we can't force someone to do it, but
Right.
you can tell them why, from a medical perspective, you think it would be beneficial.
Mm-hmm.
Yeah.
Sorry, just to rewind for a minute.
Mhm.
When patients come in, do you think it's important on their birth plans to write down any medical conditions, allergies, all of that they have?
I mean, I'm not too worried about that because as their provider, I should be knowing that
Mm-hmm.
anyways. So if I get a patient that comes in and they're not specifically my patient, I'm reviewing their prenatal
Yeah,
record
and
to
everyone
see
has record.
everyone
Yeah.
should be doing that. And if there's something significant, we usually put it in a certain part of their prenatal record or on that little pink
Mm-hmm.
sticky in their chart.
Mm-hmm.
Yeah.
So it's flagged for
So
everyone.
I don't, I'm, I,
People don't need to come in with
I don't
it.
think so.
No.
No.
They get enough histories from the
Yeah,
nurse,
I
then
know.
the doc, then the resident,
Yeah.
then the
They're like, oh, do I have to tell the story again?
anesthesiologist. Yeah.
Yeah.
Having said that, though, I think it's important for partners to
Mhm.
be aware of what allergies, what medications
Yeah.
they may be taking, and what allergies
That's
they
true
should
because
have.
they might not be able to verbalize that.
Yeah.
Yeah.
Mm-hmm.
So, any men or support people out there,
Yeah.
know the allergies and the medications
Yeah.
that your woman's taking.
And if your woman's on a lot of medications, just print it out. Yeah, and bring
Yeah.
it. That's what I do for my senior patients before we were in Connect Care. I would
Yeah.
print it out for them. I say, keep it in your wallet
Mm-hmm.
so that if they went to emerge,
So smart.
because sometimes people don't even know why they're taking stuff.
Mm.
Why are you on this? I don't know. My doctor gave it to me. And you're like, okay, all
Sure.
right, there's a reason.
Yeah.
Yeah.
Okay, next on the list, we have a list of kind of 3 or 4 different things. I want to deliver by a water birth, cesarean section, vaginal delivery, forceps, or vacuum.
Okay.
Those are your 5 options, and you
Okay.
get to circle one.
Okay.
What are your thoughts on this birth plan?
If they say they want a very specific
Mhm.
thing, well, I don't think I've ever had anyone say I want forceps or a vacuum. So
They probably
that's very unlikely to be on a birth plan. Water births, I mean, we don't do them. I think only the midwives are doing
Yeah.
them. As far as I can tell, none of the
That's
family
correct.
doctors
Yeah,
are doing
yeah.
them or the obstetricians. So I just say, unfortunately, that's not an option. But you can go in the shower and, well, not during delivery, but during labor. Lots of patients want an elective C section. And I mean, I think over the years, it's gradually gotten a lot more common.
Mm.
So I always tell them, I can't make that decision. I'm not the obstetrician. So I just refer them and then they talk to the OB and they make that decision. I would say for the most part, people still want a vaginal delivery. And I do talk to them. I think there's a lot of, again, misinformation about forceps and that they're this horrible, dangerous thing. So I think it's just about educating them.
Mm.
Why are we going to do it? We're always going to talk to you about it first and tell you why we're doing it, what the risks are. And if you're really, really uncomfortable, you do have the option to say no. But I also reiterate, sometimes it's safer than anything else. Like it's safer than a C-section, depending on where the head is, or,
Right.
some people are very slick at doing
Yeah.
forceps.
Yeah, we've got
as we
some
know.
amazing doctors
Yeah.
who are great.
They're great.
And I feel like all of the doctors err on the side of caution that if
Yeah.
it's not coming, it's
Yeah.
not coming. Abort.
Yeah.
cesarean section. So
Yeah.
mhm.
And even, when I do vacuums, I'll say if I feel like once I put the vacuum on, because sometimes you just can't tell. I mean, you're not going to do it if you don't think it's safe, but I'll say if it's not coming easily or I don't think things are going the way that they should be, I'm abandoning ship and
Yeah.
getting the OB involved.
The reason I brought up all of the options, I just found it interesting that you only were allowed to circle one. So people come into the hospital setting with this mindset of, I'm having a vaginal delivery
Okay.
at all costs.
Right.
Whereas we know in the business, having an
Yeah.
open mind.
And to be honest, when I talk about birth plans with patients, I'm always the best thing that you can do is be open minded. This is your ideal, but it might not happen.
Mhm.
So you need to be open minded. And again, the goal is a healthy mom and a healthy baby, and whatever it takes to get there, that's what you want.
Mhm.
And most people are pretty good and they're like, and sometimes you do get people that are very, very, nope, it's only going to be this way. And you're like, might not be that way. So, you just try and pre warn them, but that's really all you can do.
Mhm.
And you just cross your fingers and hope it does go that way. But as we know, it often does not go that way.
Yeah.
Yeah. I find the more fixated people
Yes.
are about certain things,
Absolutely.
the more likely it's like the law of attraction.
I know.
Mhm.
Things go that way.
That's
The more
so true.
flexible you
Yeah.
are. And like you're saying, healthy baby, healthy mom.
Absolutely.
That's got to be, that's the best plan, I think.
Well, and I think if you're too rigid too, those are the ones that you really worry about postpartum depression,
Mm.
like, post traumatic stress.
Mhm.
Yeah.
I mean, it's not an easy thing, right? Motherhood, pregnancy, delivery,
Yeah.
it's a really vulnerable state.
Yeah.
Here it comes. Delayed cord
clamping.
clamping.
Yes.
Yes or no?
Yes. I think
Okay.
there's obviously been research that shows that it's beneficial up to a certain point, and that's why it's standard of care now. So people often say, well, I want delayed cord clamping. And I'm like, we do that regardless. But I always preface it with as long as the baby is okay. So if we're really concerned about the baby, we might not wait that full minute and we might have to get it over to the warmer. Some people, well, I want to do it till it stops pulsating. And there's all those scenarios. So again, I just think it's about educating them. Most of the benefit is within the first minute or two. After that, one thing that I've noticed since we started doing this, it's really hard sometimes to get cord gases, because the arteries have collapsed.
Right.
And it's sometimes really hard. So for babies that, you're really concerned about, let's say the fetal heart during labor and you want to know what their cord gases are, again, I wouldn't want to go longer than a minute.
Right. Because those values are important to the treatment. The picture.
So for people out there that don't know what cord gases are, can you explain those?
So it's basically looking at what is the oxygenation of the blood that the baby was getting. So it can dictate sometimes how they're managed post-delivery. Maybe we monitor them a little bit closely. We might do blood sugars if they've had certain resuscitative measures done. So that's kind of what it's looking at.
Mhm.
Yeah.
Okay. Thanks for clearing that one up because that was a big one. Another big topic centering around babies is vitamin K. Personal thoughts about this?
So we're seeing a lot more patients refusing vitamin K than we used to. So again, it's about education before they get to the hospital. Most of the things I think are important to talk about before the actual timing because when you're exhausted, you've had a 36-hour labor, like you don't want to listen to me ramble on about vitamin K, right? So I do think most of these topics are better dealt with before they get to the hospital. So I'm very pro vitamin K, obviously.
This is your platform. Please ramble about vitamin K right now.
So, I try and put it in very simple terms.
Yeah.
We don't expect your baby to bleed, but their liver also isn't functioning yet to produce all the clotting factors, and vitamin K helps with that. So every delivery, there's a risk of, and I mean, I don't know, I'm pretty blunt. There's a small risk, but still a risk that they could bleed into their brain. We want to be able for them to stop bleeding into their brain, and vitamin K is going to help with that. There is the option to get oral vitamin K. It's been shown not to work as effectively, but it still does provide some coverage. And, some parents are like, well, I don't want my baby poked. It's more about the needle than the actual vitamin K,
Mhm.
which it's a poke. I mean, it is, but again, babies don't have permanent memory, so they're not going to remember it. And most babies don't even cry, really. Like
Right.
some do, but
Right. Is it a vaccine?
no,
It's
it is not a vaccine.
That seems to be some
Is
misinformation
it?
as of
Okay.
late. I don't.
Mhm.
I haven't heard that one yet.
Oh, yeah.
No,
Yeah.
it is not a vaccine.
Mhm.
And
Sometimes mom asks, well, if I take it, can they get it through my breast milk? No, not going to
Not
be
enough.
not enough.
Yeah.
No.
And I agree with you. Like most babies, they may go
To bleed.
wah
Yeah.
when they get the injection, and
Yeah.
then you give them their finger to suck
Yeah.
on, or they're at the breast and it's just a wah, and then
And
they
then they're
comfort
done.
themselves.
Yeah,
Yeah.
exactly. And I get it. I mean, no one wants to hurt none of
Yeah.
us want our babies to be in pain. But it's the same with when we have to do frenotomies or tongue tie releases, it's the same thing, right? Like lots of them don't even cry. Yeah.
Wow.
Yeah.
Yeah. Like lots of them don't even cry. And if they do, for the most part, it's very, very brief.
Yeah.
And then, you put your finger in their mouth and they just start sucking it. So,
That's got to be a tricky thing to do. I've never witnessed it.
mhm. It's not
Walk
that
us through it.
tricky. It's not that
A
tricky.
tiny little mouth, tiny little tongue. What? Tell us.
I don't know. I've done so many. I'm just like, it's not that tricky. Yeah, like you just literally just cut with iris scissors the little
Yeah.
frenulum that's under their tongue. Someone's holding the head still. That's the key.
Okay.
Because sometimes you got to have someone holding that head. You don't want them to move their head right while you're cutting. Yeah. And again, like there's certain things you have to be careful of. If their mom has a bleeding disorder or something like that, you're not going to do that. Yeah.
And then for our listeners too, can you explain reasons why?
Yeah.
would need that?
I mean, years ago, we used to just cut them if they had one, and we've really stopped doing that. So it's mostly dependent on if they're having a lot of pain with breastfeeding, if it's affecting the latch. And it's not necessarily about how far they can get their tongue out, although that is part of it. It's more, can they get their tongue to the roof of their mouth? Because that's what causes that negative suction to bring the milk out of the breast. I mean, it's a pretty simple procedure, to be honest,
You're
but it can
doing-
make a huge difference to breastfeeding.
Okay.
There's a few that I'll still do in hospital. And I mean, so my kids both had them and they were severe. So I remember when my first one, it wasn't recognized for over a week. And I was just like, oh my God, this breastfeeding sucks. But, you push through. You're just like, this is best for my baby. I don't care how much it hurts. Every 3 hours, I'm just going to just do it, And when I had my daughter, she had a severe tongue tie and I was like, she is not coming near me until that thing is cut. So for people like that, where it's so obvious, they can't even basically move their tongue or very little. I'm just like, why put them through a couple days of
Right.
misery potentially?
Yeah.
And then for other ones, like, we've learned, let's give you a few days. You might not even need it. And lots of times they don't, it's just a learning curve more that's causing pain than the actual tongue tie is causing a problem. Yeah. I hardly ever do them in the hospital anymore. Very,
Interesting.
very
Yeah.
occasionally.
I
You don't
was-
see them very often
No,
anymore.
no.
Yeah.
And do you use those terms of functional tongue tie or a non-functional tongue tie? I've heard this lingo.
No. Patients just want simple. I'm like a keep it simple, stupid kind of doctor.
I love it.
I just speak in simple terms.
Yeah.
Baby's got a tongue tie. Does it cause you pain or doesn't it? End of story. And then I'll assess the baby, obviously, but I don't get into too much.
Okay.
I don't know. I just think everything's complicated enough.
Yeah.
Let's just keep it simple.
Speaking
Yeah.
of simple terms,
Yes.
on my birth plan here, I actually haven't heard this one before. Maybe you have.
Maybe I haven't either.
It says, in case of a cesarean section, I would like a gentle cesarean section. Have you heard that before?
I have not heard that before. Maybe
have.
the OBs have.
I've heard it a couple of times.
What is that? I don't know what that
what
would
does it
even
mean?
mean.
I don't know either.
No.
You have heard
You'll
it?
have to
I
ask-
have heard it. I've seen it on a couple of birth plans lately.
Interesting.
And I'm like, and that's what I've thought. What does this mean?
I'm going to have to ask the OBs. I'm curious
Mhm.
now. You'll
Mhm.
have to ask the next OB that's on your show.
Yeah.
Yeah.
Next
Or
week.
We
Yeah.
might need to get onto TikTok. Find
That's
out
where
what
we
this
get our
is.
information.
There you go. And then tell the patients it comes from a very reliable
Yeah.
source.
Not
yeah.
the OB.
Yeah, not the
TikTok.
OB, but TikTok.
TikTok.
There you go.
Because is that where you heard it? Was off a birth plan?
Just right here.
Oh, that's the
Interesting.
first time you've seen
First
it.
time seeing it. Yeah.
Oh, there's themes that walk in the door,
Yes,
right?
for sure.
So there was one day where there was a few patients that came in, and the reason why they came was because of lightning crotch. Have you heard of this?
I have heard of lightning crotch many, many times, and I believe I experienced it when I was pregnant.
Okay, tell us about it.
Okay, so to me, when people talk about lightning crotch, and it's a very common term, so I'm suspecting it's out there on social media somewhere.
I'm suspecting too.
They describe it as feeling like all of a sudden they get severe, almost like lightning pain up their vagina.
Okay.
And I think sometimes, do I know exactly what it is? No, but I think sometimes it's maybe fetal movement down below, maybe your bladder spasms a little bit. Like, and when I was pregnant, all of a sudden it would just catch me. I'd be like, ooh, and then it would just go away. Right. So that's what I think lightning crotch is. And
Yeah.
I'm just like, it's okay. I think it's pretty common. Like, but I basically tell them it's not dangerous.
Okay.
Yeah. It's not dangerous. You don't need to go to the hospital. It's not labor. Right.
Okay.
Yeah.
Oh.
Yes. Hiccups are also not dangerous. You don't need to go to the hospital for hiccups.
What does a pregnant woman feel when she's experiencing hiccups?
So depending on where the head is, you're going to feel like almost like a rhythmic kind of tapping, or I wouldn't say it's movement, but you can feel it, but it's going to be rhythmic. It's not going to be, random. It's going to come quite regularly at regular intervals. And then it just goes away. Not a seizure.
Another thing that's flying around social media is active fetal movement. So too much fetal movement are bringing patients into triage.
Yes.
If you could comment on that, that would be good.
Yeah. So I tell my patients, some babies are very active, other babies aren't. Active fetal movement, or more than if your baby's very active, that is not dangerous. That's reassuring for us. It's more if they're not moving that it's an issue.
Well, circling back to fetal movement, what gestational age do you recommend starting to do the fetal kick counts?
Yeah.
And please explain all of that to us.
Okay, so usually we tell them between 28 to 30 weeks, you can start having predictable fetal movement, which means that you're able to get 6 movements within a 2-hour period. Not every 2 hours, because some people will count every 2 hours. It's once a day. When you think that your baby, some people say, well, I only feel my baby at night. Then do your counts at night. It's not that they're not moving during the day. I guarantee if you paid attention, they're moving. And I also stress, as the baby gets bigger, or even if it's just like a little nudge, that's still considered a movement. Yeah.
I had a good tip from a colleague of mine because I had anterior placenta with both of my girls,
Which can be stressful.
which brought me in to triage a time or two.
Absolutely.
Because I wasn't feeling the movement. And then she said, she also had anterior placenta. She said, hold your hands out to the side because your baby's kicking the placenta. You won't feel it here, but put your hands out here and you will feel
That's
the
a good
movements
point.
there, down in the crotch, up here.
Lightning crotch.
Yeah, I did get
Yeah.
the lightning crotch too.
Well, and I always tell people too, just put your hands on your belly too. Like, don't look for it, because some people really have a hard time, especially if they have an anterior placenta,
Yeah.
feeling those movements, or they think it has to be like a big whammo punch. And I'm
Right.
like, it doesn't have to be that. And I say to them, so if you counted for 10 minutes and you get 6 movements, you're done. You don't have to sit there for 2 hours.
And then the movements, do they change along the way when the babies are smaller? Are you getting more movements? Is that a
So
thing?
I kind of tell patients as the pregnancy gets further along, they get bigger. There's not as much room. So you're not going to get those you might not get those super intense movements. It might just be a little roll or a little nudge, but that's still considered a movement. Yeah.
Having said all this, I will say that we're happy at any time to see people in hospital for decreased fetal movement. Like when in doubt, if patients are sitting at
Absolutely.
home, humming, hawing, should I go in? Should I not?
Absolutely.
Go in.
Yeah.
Oh,
It's an easy thing to monitor.
Yeah.
Yeah.
But the first step, if you're pregnant and you're like, oh, I haven't felt the baby move in a while, that's when
Yes. Sit down, pay attention, do your count. And if you don't get adequate movement,
Come.
go to
Come
the
see us.
hospital. Yeah.
Yeah.
Juice, apple juice. What were you going to say?
I mean, yeah, I think that's fine. They say it doesn't make a difference. I don't know, but
I think it
anecdotally,
does.
I think it does
like
too.
it.
I'm a fan of chocolate.
Yeah, right?
Have a
No
piece of chocolate.
Hey, if
over
I have any
70%.
excuse to take chocolate, I'm in.
Mhm,
Yeah,
mhm.
absolutely.
And actually, Catherine and I were talking about the fetal movements and counting them. And quite often people are distracted. They're distracted with their phones.
Absolutely.
So when they're
Yeah.
doing their counts, they need to put their phone away, turn their TV off.
Yeah.
And that's what they're doing.
So I usually tell them, go in a room by yourself. Your kids aren't around. Your husband's not around. You're by yourself and you're literally just sitting there, hands on the belly, closing your eyes and counting. Yeah.
Brilliant.
Yeah.
You hear that, everyone?
By yourself. No children.
No children.
Mom.
Enjoy the
Yeah.
break.
Yeah. Enjoy the break. Exactly.
Yeah.
Group B strep.
Yes.
What is the testing for it? What's the gestational age in which you're testing? What's it all about?
Okay. So group B streptococcus is a type of bacteria that some women just naturally have in their vagina. So the vagina has a whole bunch of different bacteria. It's kind of like our cleaning system, if you will. However, for babies, it can cause significant illnesses. So, meningitis, pneumonia, sepsis, all of the bad things that we don't want babies to get. So if you have it in the vagina, so we test everyone, our group tests everyone at 36 weeks.
Okay.
And it's just a swab. It's fairly easy. You do have to go in the vagina and then touch their rectum as well. And then if they're positive, you give them antibiotics in labor. Really, the baby is protected until their amniotic sac breaks. And then they're exposed to all the bacteria and all of the things in the vagina. So yeah, that's kind of what that is. And it just is to help prevent infection in the baby.
Okay.
Yeah.
So as soon as they go into labor or as soon as their water breaks,
Yes.
that's when they get started with antibiotics.
Yeah.
And then what if they're allergic to penicillin?
Then on the swab, you ask for sensitivity and then they basically check in the lab what antibiotics are sensitive to it. And then you'd give them an alternative. But, a lot of people think they're allergic to penicillin and they're truly not allergic. So now what we do, I think most of the docs in my group anyway, if someone comes in for their first prenatal and we always ask them, do you have any allergies? If they say, I'm allergic to penicillin, okay, what kind of reaction did you have? When
A rash
was
as
it?
a child?
Yes.
Is that the biggest one?
Yes, that's
Okay.
the biggest one. Or, oh, my mom told me I was. So then we actually send them to an allergist to confirm the penicillin allergy, and they're pretty good at getting them in very quickly.
So
Yeah.
it's safe to test while they're
Yeah.
pregnant?
Yep.
Okay.
Yeah. So then I would say at least half come back saying they're not allergic to penicillin.
Interesting.
Because that really changes a lot of things,
Oh,
like
yeah.
not just for pregnancy, but for
Yeah.
a lot of infections
Absolutely.
where we would use penicillin or a penicillin derivative, right? So
Yeah.
So we've been sending almost all of our patients, unless they say, you know what, I had it 10 years ago and I was anaphylactic, then you're just like, okay, we won't give you any penicillin, right? But if it's,
Yeah.
oh, I was a kid and I had a rash, or my mom said I was, or reassurance, but
That's awesome.
yeah.
Is it safe to eat your placenta?
That came out of left field. Did you eat your placenta?
Would
Did
you
you make
want
pills
to
out
eat
of it?
your placenta? No, I definitely did not eat my placenta. To me, the placenta is an amazing thing. It provides an amazing function, but once it's done its job, it's time for it to go. Yeah. So I'm not a big fan of getting your placenta encapsulated and dried. So there's a number of issues. One is who's doing this, because it's not done by like an approved facility, I
Mhm.
doubt. So I saw on CBC once, they interviewed someone who actually does it. And I was mortified because they did it in their kitchen. She didn't have an autoclave. So the instruments that they're using, I don't know, like how many are you doing? How are you cleaning them properly? Are you actually getting your placenta? Is it mixed in with someone else's? I don't know. And really, there's no evidence to show it provides any nutritional value to the mother.
Mm.
So in my opinion, it's a hard no.
That's fair.
Yeah. And I mean, if people want to do it, that's up to them. But I also think they need to know I think you need to have that conversation. Yeah.
Mhm. And then is there any forms that need to be signed
Yes.
if people want to take their placenta home?
Yeah. So there is a form. If you want to take your placenta home, we make you sign a form saying that you're aware of the potential risk or, yeah.
Not everybody that wants to take their placenta home has
Right.
the intention of
No.
eating it.
Yep.
What are some things that people are doing with their placentas?
I would
Do you know?
say, I've heard a couple things. I would say that one of the most common other reasons is they want to plant it with a tree, or
Yeah.
some give it to their dogs to
Mm.
eat. Again, I wouldn't be doing that, but that's just me. Probably planting it with a tree is very common.
Art. Have you heard of placenta art?
I have not. What is it? Just they.
Like a print of it,
Oh,
because
okay.
it looks like the tree of life.
Yeah.
Yeah.
That
It
might
is
be kind of
it is
cool.
beautiful, the
Yeah.
placenta. Yeah.
It's an amazing thing,
Mm-hmm.
right? Like, to think that it's sustaining life for someone.
Yeah.
Really, it is quite amazing.
Yeah.
That would be kind of cool. I'd be into the
Wear
art
gloves,
thing.
double gloves.
Double gloves. Yeah,
Sometimes people want to see their placenta. Do you
Yes.
give placenta tours?
absolutely. I am
Tell us about
fully on
them.
board with a placenta tour. So I basically just show them, okay, this is the part that's attached to the uterus. This is, the cord with the blood vessels. This is the sac that's around the baby. Yeah. Lots of people find it quite interesting.
It is pretty cool.
And I think
when
it's
you hold it up.
amazing. I think
Mhm.
it's
Yeah.
an amazing
Mhm.
thing, right?
Mhm.
So
Yeah.
I have no problem showing them.
It's just not good for people that aren't good with blood because there's blood
Very
involved.
true. Yeah.
I love a good placenta. We've seen lots of cool ones over the years.
Yeah. And
Twins
some
are
of them
really
are
cool.
really interesting, right?
Yes, yeah.
Yeah.
True knots. True
Yeah.
knots are incredible.
Yeah.
Yeah, there's some cool placentas out there. But just to look at and then say,
Yeah. And then
Goodbye.
say, okay, goodbye. Yeah.
you served your purpose.
Serve
well
your
done.
purpose. Thank you.
Yeah.
Au revoir.
It's amazing too how the amniotic sac, how it has the two layers, the amnion and the chorion, and just how sturdy it is.
Oh,
Right?
really, it is,
Yeah.
right? Yeah, it's amazing.
Mhm. Dr. Charlene Kennedy, thank you for coming on the show today.
Thank you for having me.
And all
It was
your
a pleasure.
wisdom has
Oh.
been amazing, and hopefully it will spread wide and far. And
You shall see.
thank you so much.
Yeah, you're welcome. Thanks for having me.
Thank you very much. Do you have any other things that you'd like to share? Any nuggets of wisdom or funny stories?
I can't think of anything outrageous, but I mean, really, it's about just be flexible. Just be flexible and know that we are there to provide care so that at the end of it, everybody's healthy. That's our goal. Yeah.
Beautiful.
Love
Yeah.
it. Thank you so much.
Thanks for having me.
We appreciate you.
Over and out. Over and out.
If you have any questions about what you heard today, please reach out. Sarah and I would love to hear from you. Email us at birthslater@yahoo.com. That's birthslater@yahoo.com. We are here to support you every step of the way. And now for the legal language. This podcast is solely for educational and entertainment purposes. This podcast is not intended as a substitute for professional advice from qualified individuals involved in your prenatal, labor, and postnatal care. Every pregnancy and birth is different, so always talk to your healthcare provider about what's right for you.